What's the others doing? So let's do a recap of what we did last 2 weeks. Who can help with that? A recap of what we did last 2 weeks on the lectures we had, so that we can continue from there. Who can help with that? A recap of what we did last 2 weeks so that we can continue from there. Can you hear me, please?
Yes, sir.
Yes, sir.
Okay, sir, please let me start. Okay, so the last time we spoke about we spoke about some branches of laboratory investigation. We spoke about some of the chemistry tests that have been done, some of the hematology tests that have been done, and then we also spoke about some of the microbiology tests and the rest. Thank you.
Welcome. Who else can add up? Who want to add up?
Yes, hello? Hello?
Okay.
Hello?
Ingrid,
Can you hear me?
you can go on. We
Yes.
can hear you.
Yes. So we spoke about yes. Okay. So we spoke about the form that needs to be used to formalize the request for lab investigation. So lab testing. So for those who don't have uh, you, we could create a form as well as for some areas it was suggested that persons could use like another facility who already has that setup. So we talked about that for lab information for a
Okay.
patient. Thank you.
Thank you. Who else? Okay, Philip.
Yes, sir. Thank you,
Philip, your hand.
Doc, for the opportunity. Yes, please. I also remember you talked about the reference values. Whenever a lab request is being done, um, the report comes out and you compare it to the reference values being already stated out there. So, for example, when you're looking at the hemoglobin in male, you say you have 13 points, something to 16 points, and that of a female adult too. So I could remember we even talk about why some of the times the lab report should not be given to the client. We also contemplated that at times when you give the lab report to the client, um, we don't normally do that in order to protect for patient safety and other things. Thank you so much.
Okay, thank you. Who else? Peter, please, you can go on.
Yeah, we also said that you should, if you, anytime you have a lab report, you should have a copy with you to use it to cross check whether what was requested was exactly what they did.
That's fine. Who else want to add up?
Yes, I wanted to add to that, please. Oh, sorry, should I put up my hand now? Yes, so it's important to communicate how we communicate the results to the patient, because in some instances it would be better that the doctor is the one who presents to the client, because he's the one who is able to interpret what the lab says. And also, it's important to be accurate in recording both the request and the result. In the results, because it can lead incorrect information, can lead to distress with the client, with the patient, if they get information that is not favorable and might distress them more, or they might be thinking another relationship in communication between the doctor and the patient.
Okay, thank you. Peter, your hand is up again. Peter, do you want to add up again? Okay, so let's continue with today's lectures. Apia, I think your hand is up. You want to add
Yes, sir.
something?
Yeah, I also
Okay, go
remember
ahead.
you said that if we are able to have at least 2 or 3 lab report confirming of the same condition, it give you the upper hand in terms of the particular condition you are looking at. So sometimes having a multiple lab report on a particular condition is very helpful.
Okay, so with what Peter said, I just want to add one or two things to what Peter just said. And that one depends if you are not sure of the results that is coming in per your diagnosis, then you can go for a second opinion or a second laboratory request from a different facility to compare the results. But if you are okay with the results that is coming in from your preferred laboratory, then it's okay to go ahead with the treatment. Can we continue or someone want to add up? Okay, so
Something. Hello.
Evening. This is
Hello,
Eunice
sir. Can I
Watkins.
talk?
Can you hear me?
um,
Can
go
you hear
ahead.
me?
Eunice, we can hear you.
Yes, we learned about the different types of tests that can be done. Different types of blood tests that can be done in the lab.
Okay, go ahead.
We have the urinary routine examination. We have full blood count examination. Hepatitis B surface examination, thyroid test, food, etc.
Okay, okay, that's fine. Achampo, Your hand was up. Meshach.
Yeah, so I wanted to ask a little question with regards to the authenticity of the report. So you made mention that if you are not sure of the result, we can check from other medical hospital or other lab facilities. But in case the two reports come in and then there is a little margin, what do you do with regards to that? Do you rerun another test to verify, or you maintain the second one and then go about your procedure?
Okay, so we'll take your question and then we'll write it down. Then now during the lectures, when the need arises, we'll go back to it and then we'll answer that question. So let's put it down. So today we'll be looking at sample collection tubes. Last, we made mention of the sterile urine container or sterile stool container. So today we are looking at the blood sample collection tubes. We made mention of them briefly, but we'll look at it and then we'll see the difference between the tubes. Sample collection tubes or sample tubes are sterile color-coded glass or plastic tubes used in lab to collect, transport, and process blood or other body fluids for testing. The color of the cap indicates the type of additive in the tube, which determines how the sample is prepared, either a serum, whole blood, or a plasma, and what tests can be done with these samples.
Yeah, I can't hear anything. Oh, it's from my phone. Hello.
So we can hear.
Can you hear me now?
Yes,
Yes,
sir.
yes, we can hear you. Yes, we can hear you.
Common sample tubes and their uses. So let me show you the picture of the sample tubes and then we'll come to their uses. So this is a photograph of the sample tubes. We have the yellow, the blue, the gray, light green, red, and then the purple sample tubes. And each tube determines what kind of test can be done within that samples or with that samples. So let's look at the tube with the red cap or the red top. That is a plain tube or serum tube. This tube contains no additive, but aids in clotting of the blood sample. Primary use is for serum testing, test that requires serum for the analysis. Example is the chemistry test, such as liver function test, kidney test, electrolytes, or other serological tests. Example, hepatitis B screening. We have the gold top or the yellow top. That is the serum separator tube. It contains an additive that is a clot activator plus a gel separator. Its primary use is for serum testing or tests that need serums for the analysis. An example of such test is liver function test, kidney function test, lipid profile or cholesterol test, and any other serological test. The main purpose of the gel in the tube is to separate the serum from the whole blood after it has been separated with a centrifuge. Then we have the purple top tube, which contains the EDTA, which is an anticoagulant. The main purpose of that tube is to prevent clotting of the blood sample. And this tube or samples that are in these tubes can be used for hematological purposes, such as FVC, the full blood count, or the complete blood count, and then the blood film. It can also be used for molecular testings at the molecular level, such as using the PCR or the gene expert machine for HIV count. That's the CD4 count. We have the green top, which contains the heparin, which is also an anticoagulant. Primary use is for plasma chemistries, like the electrolytes, and then the ammonia test. We have the gray top, which contains sodium fluoride. Primary use is for glucose and lactase testing. The purpose of the sodium fluoride as an additive in the tube is to preserve the glucose from degradation. So the sample can be taken or the blood can be taken into the gray tube, and then the glucose test can be done after. And then the results will come in perfectly as it is expected. Then we have the light blue top, which contains the citrate. It is also an anticoagulant. Which is used for coagulation studies. So let's go back to the photos and then we have a look at it again. We have the yellow tube there. It can either be called the gold tube because it has the color looks like a gold. That's the cap. We have the blue, then the gray, green, red, and then the lavender or the purple, which is mostly used. The yellow and then the purple is the most common one used for sample taking. The yellow tube can be used for all biochemical tests because this one can aid in clotting of the sample and then the serum can be obtained. Whilst the lavender or the purple prevents clotting of the sample because it contains the anticoagulants. Each tube has a volume of sample that need to be taken depending on the type of tube you are using. So when you see the tube, there is a mark on it which indicates the volume. But most common, we have the 3 mils volume that is mostly used. But with the tube, you will see the volume indicated on it, or the mils need to be taken. When you take less the volume, it can interfere with the results because the additive will work on the sample and then it will interfere with the results. So mostly the required volume is required or is needed for the test. Last week, we also talked about the storage and then the transport of the biological samples. Now, this one is for blood storage. About the room temperature, that's when the blood is drawn and placed into the sample before it is being transported to the laboratory. It can be stored at 15 to 25 degrees for a short period, but should ideally be processed or refrigerated as soon as possible. When the sample is taken and then accessing the laboratory will take some time, then you need to process it and then refrigerate it so that you can transport it when it is needed. We don't leave the sample on the working bench or you leave the sample down just like that. There could be degradation of the sample. So if the sample cannot be transported as early as possible, you process it and then you refrigerate it at a temperature of 2 degrees to 8 degrees. And this sample can be used within some days, or you can store it and then it can be used within some days. But if it should be used to be stored for a very long time, then you have to freeze it at a temperature of minus 80 degrees Celsius. Refrigerators and freezers should operate at optimal settings. That's the optimal temperature. If it's a refrigerator, you should have a temperature chart or a thermometer on the refrigerator so that you'll be able to monitor the temperature of the refrigerator. Some refrigerators come in with a thermometer or a temperature monitoring device on it. If the refrigerator does not have it, you can buy an external thermometer with a timer so that you can monitor it, so that it can be monitored. For safe transportation of biological samples, clearly label biohazardous package with the content. So if the content is a blood sample, you label it. If it is highly infectious, you indicate it on the package so that when it is being transported, care will be taken. Then during transportation, you maintain the necessary temperature conditions for temperature sensitive samples. Some samples need to be transported within a certain temperature range. So you make sure those samples are transported within that temperature so that it will not interfere with the outcome. That's the result that will come in. Use insulated containers or ice packs. And then there's transport bags or buses can also be used to transport these samples to the necessary facility for the necessary investigations to be done. So we'll be looking at infection prevention and then control because we're taking samples, and whilst taking the samples, we'll come into contact with contaminations and then infectious samples. Every sample is to be treated as infectious, irrespective of where the sample comes from. Whether it's your friend, your sister, a family member, the sample is to be treated as infectious. So the necessary protocols and standards need to be followed. You wear your PPEs. If you are supposed to put on the gloves, you put it on. You follow the necessary protocols before you take the samples, because every sample is considered as an infectious sample, irrespective of where it is coming from. One of the major infection prevention control is waste segregation and then disposal of the biological waste. Waste segregation. What is waste segregation? It's the process of separating different types of waste material based on their characteristics, hazards, and disposal requirements. This practice is crucial in various settings, particularly in laboratories and hospitals, to ensure safety, environmental protection, and compliance with regulations. So let's look at how we segregate or separate our waste for safe disposals. We have different types of waste. As we take the samples, we generate waste. It could come from the package of the syringe. It could come from the sharp, that's the needle from the syringe. It could come from the consumables that we used during the sample taking. It could be the cotton that was used for disinfecting the site before the sample is taken. So let's look at the sharps. Needles, that's needles from the syringe that was used for the sample taking, and other sharp instruments that could cut or puncture. Then we have the chemical waste. It could come from reagents or solvents and any hazardous chemicals. Then we have the general waste. That's the consumables that was used, the waste that was produced from the consumables, like the package, uh, the cotton that was used for disinfecting the sites before the sample was taken. So the general waste that does not pose biological or chemical hazards can be separated from the infectious waste. So in the F settings, there are color codings and then how the segregation is done. Use of color coded bins for disposal of waste. We have the red bins, biohazardous waste, such as contaminated glass, blood soaked material such as gauze or swabs, yellow bins, that is infectious waste, that's medical or infectious waste. After taking the sample, cotton wool was placed on the puncture site to stop the bleeding. After the cotton is taken, and then it must be placed in the infectious waste bin. You don't add it to the general waste bin. We have the black bin, which is sometimes not found in our settings. But mostly we see the general waste and then the infectious waste. That's the yellow, and then the general waste, which is sometimes black, depending on what they have at the moment. Then we have the sharp containers, puncture-proof bins. Needles, blades, and other sharp objects need to be placed into the sharp containers or sharp boxes. Any other items that could puncture regular waste bags need to be placed into the sharp containers or the sharp bins. These are all parts of waste segregation. It's very important, and this reduces infection and then contamination. Any questions so far, or any contribution? With the waste segregation and disposal. KJ.
Sir, please. Good evening.
All right, sir. Good evening. Okay, sir. Please, my question has to do with the containers, the color, with the colors. Like you said, the purple contains. Okay, let me say what the chemicals in the containers. Before you add the sample, do you have the chemicals in it already before the sample is being added, or the glass is being manufactured with that particular kind of chemicals, like the serum and then all that, the gel? Thank you.
Any other question? Emmanuel.
Yes, sir. Question. Okay, so I just wanted to find out, most of our facilities, when you go there, there's supposed to be segregation of this, what we call the bin rubbers, and the colors will tell what that particular bin is for. But sometimes, because of shortage of, let's say, the red or the yellow, we just put out all the bins to be black, 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 black. I don't know if you understand me. And sometimes you enter a facility and realize that in the next station, the rubber there is black everywhere. But when they are really putting the items in, they know which is for which. Can that also be done? Because I've seen it before. Let's say they just have a sticker that they post it on the bin to show that, okay, this is for hazardous waste, this is for infectious waste, and the rest, without using the bin liners. That's the name I was looking for, the bin liners, the colored bin liners. Thank you.
Okay, so let's put this one also down. After we will answer all of them. Okay, we have Philip.
Yeah, Doc, thank
Philip.
you. Yeah, Doc, thank you so much. Yes, you made mention of reagent. So can you please explain what a reagent is?
Okay, so we have three questions, I think three or four. So let's tackle these three or four, then we'll continue from there. So with the first one, um, he made mention of whether the containers or the tubes that comes in are already prepared or manufactured with the additive in it. Yes, they already come as manufactured, so it is indicated and what additive contain or is contained in that particular tube. So with the EDTA, you see it written boldly on it that it contains the EDTA. That is the one with the purple color, purple cap or the purple top. The additive is written on it boldly and then firmly. So you will see it written on it. So all the tubes that comes in are already manufactured, and then they contains this additive for a specific purpose. So we don't use different tubes for different diagnosis or different laboratory tests. If you are going in for a chemistry test, you know that you have to use the the gold or the yellow cap tube for the chemistry test or serological test. If you are going in for a test that you don't need the sample to be clotted, then you go in for the lavender or the purple tube. If you are going to do glucose and you are not going to do it instantly, you need to take the sample and then transport it to the lab. You use the appropriate tube, that is the gray one, which contains the sodium fluoride. So every tube indicates the kind of test that can be used for. Then the next one was with the beans. You go to the facility and then you don't see the appropriate color beans or the bean linings. Maybe you see all black, black. But with the bean container, they have labeled it. If it is a general waste, they've labeled it general waste. If it is infectious, they've labeled it. But ideally, we are supposed to get the appropriate bean linings for the beans. But because of financial constraints and then shortage, they try to um, improvise. And then maybe they'll go in for the black, black, black. But the container itself that the bean is inside has been labeled. And then the third question, well, what was the third question? Can you please come again? Let's take the third question.
I was asking what a reagent.
Reagents. Okay, at our level where we are not performing the test, we will not need any reagents at the moment. But this is a general knowledge that there are reagents that can cause accidents and then accidents. Either maybe acid, stains, and other reagents in the laboratory. But at our level, we will not need any reagents or working with any reagents.
So I think he wanted to understand the meaning of reagent. Oh,
The meaning of reagents.
yeah, what is it?
It's a substance or a chemical that is used in performing laboratory investigation. So let's say blood group, you want to do blood group, or you want to, laboratory scientists want to perform blood grouping test. The chemical that is used to perform that test is called a reagent. Are we okay?
Yes, please, sir. Thank you.
Yes, sir. Yeah, okay.
Any other question? There was a first question. Can you come again with the first question? The very first question. I think it came from the very first question came from KJ.
Yes, please.
Okay. Can we have your question again?
Okay, so I think you've answered the question. I asked about the tubes with the additives in it. Do they manufacture it with the tubes, or is something that is later put in it? But I think you said it comes with it.
Okay.
Yeah. Thank you
Thank
very
you.
much.
Menu, Dr. Menu Charles, your hand is up.
Good evening. Yeah, my hand is up. Good evening, sir.
Go ahead.
I want to ask with the for the reagent. Hello.
Go
Said
on.
I want to ask about the reagent. The reagent.
Okay, go on.
Which of the best? Which is okay? Comparing the reagent to the strips, especially when you are doing without test. Is the reagent very, I mean, accurate more than the strip for doing the without test? Thank you.
Okay. Any other question? Blessing.
Yes, good evening. Please, I want to know how many tubes do you have in the investigation, laboratory investigation? Because what you mentioned is like we have about 6. Is there any other?
Yes, there are more.
Hello.
Yes,
Okay.
there are more tubes, but these are the mostly
Okay.
used ones, and some perform the same functions. Like the
All
one
right.
with the red top could be used as to perform the same function as the one with the yellow top or
All
the
right.
gold top.
All right.
They could do the
Okay.
same thing. So these are the very common ones and
Okay.
then available ones.
Okay. Thank you.
Okay. Then let's tackle the question with the reagents and then the test kits or the cassettes. It depends on what the clinician or the prescriber wants and what is used to perform the test. If the clinician or the prescriber wants a reader test, that one you can't use the cassette or the strips. You have to use the reagents. If the prescriber wants a typhoid test and then the prescriber test, he wants the IgM or the IgG, and then with that, it is the cassette that is used. So it depends solely on what the prescriber wants and what test is being requested. Are we okay?
Please come
Yes, sir.
again.
We are okay.
Any other question? So what I was trying to say is that when you request for a reader test needs to be done with a reagent, and then the values will come in numbers or in figures. That's the total values. So you request for a reader test, there's no need for the scientist to do a typhoid test unless you state that you want a typhoid test with the IgM and then the IgG. So when you request for a reader test will be done for you. When you request for a typhoid test with the IgM or the IgG will be done for you. So you request for a typhoid test, indicating you want the IgM and then the IgG. There wouldn't be a result that will come in as 1/20, 1/40, 1/80, or 1/360, because you are not requesting for titral values. You are requesting for a typhoid IgM or IgG test. But when you request for a reader test, that's where the results will come in. So it depends on what kind of test that the clinician or the prescriber is requesting. Recently, most of the clinicians and the prescribers are going in for the typhoid rapid diagnostic test. That's the IgM and then the IgG. The reader test is not coming in like it used to be based on advanced technology. Is your answer, your question answered?
Yes, sir, but I still want another. I still want to ask another question.
Okay, let's take, we have Christiana. Let's take Christiana, then we'll come
Yes,
back to
sir.
you.
Yes, good evening, Doc. Please,
Good
is there
evening,
any
go ahead.
difference between the reagents? Yeah, is there any difference between the reagents and then the buffers being used?
Okay, so the next person, Emmanuel, your hand is up.
Yes, sir. I just wanted to do a follow-up question. What is the difference between the IgG and also the IgE? I probably want to know that when, let's say, I request, I do the typhoid request, and then IgG is positive. What does it mean? If IgM is positive, what does it mean? Thank you, sir.
Christiana, your hand is up again. Okay, Menu, you can ask your next question. Menu, you can ask your next question.
Yeah, my question has been, said by Dr. Ima. I was talking of the differences between the reader test and the IG and the IG and whatever.
Okay.
Thank you.
So with the typhoid test, that's the IgM and then the IgG, we are looking at the antibodies that is being produced after one is infected with the Salmonella typhi bacteria. So the IgM and then the IgG indicates current or past infection. Is your question answered?
Yes, sir, it's okay. Thank you.
Sir, so please, it's
Go ahead.
it means either active or chronic. Can we say,
Yes.
let's say, if IgG is then it means active or chronic? Like, is that what it means? Okay, thank you.
Yes. So chronic depends on the stage of the infection and how long the infection has been there. So if someone can come
Okay, sir,
in
thank you.
and then the IgM the IgM will be positive and then the IgG will be positive, which indicates that the person has had an infection before and then the person was treated. And later on, the infection has come back, has reinfected his or herself. So when the results will come as IgM positive, IgG positive, meaning the person has had a current infection and then the previous infection, they are both there. So you could either get a result that states only IgM positive and then IgG negative. You can get a result that will state IgG positive, IgM negative.
Okay, sir. Thank you so much.
Dr. Apia, your hand is up.
Yes, sir. Might deal with those who want to know, since you're explaining to us, those who want to know the viral load related to the typhoid, the salmonella typhoid. If I want to know, request for lab tests to know the viral load, which of the tests am I supposed to request for?
You can request for the blood culture. Can you hear me?
Yes, sir.
Okay. So with the culture, it's an advanced stage. Maybe you've done the WIDA, you've done the typhoid test, and then the person keeps or the client keeps coming in with the same complaints. You can go in for the blood culture, which will give you a more specific microorganism that is causing the problem. Any other question?
Yes, sir. I do have a question. Can I go ahead?
Okay, really?
Yeah, William. Yeah, please. My question has to do with the fact that usually I've observed that in some of these government hospitals, when someone is infected and the person is separation maybe a wound or a saw which is being separated. They would rather take a blood culture sample from the wound. I want to understand why they do that. And yes, basically that. Why do they take blood sample from the wound to conduct a blood culture exam?
Okay. Okay. Any other question? Menu.
Okay, sir. My question has to do with the waste bins. The one with the sharp one. Are they good to be buried, or some you have to, burn it, or where do you have to dispose it? Thank you.
Okay.
Sir, please,
So
can I ask a follow-up question?
Okay.
Sir, with the feedback. Okay, so I heard about chocolate agar, where all blood samples that are donated have been in the lab for more than 3 months, 4 months, are being collected by some of the microbiology labs to be used as chocolate agar or blood agar, but they normally call it chocolate agar. So that one too, can you explain a little bit so that in case they don't dispose it off, why do they use it as chocolate agar? And doesn't it still contain the infectious disease that it contains? Thank you, sir.
Okay, with the agar, that serves as a medium for growing the microorganism. So let's say it serves as a food or nutrient for the microorganism. So depending on what kind of microorganism that you are going to culture or grow, then you will need a specific nutrient for that microorganism. So certain microorganisms grow well with the blood agar or the blood culture or the blood medium as a nutrient for them. That is why it is used.
Okay, sir. Thank you. Thank you.
But let's bear in mind that before a medium or a culture is prepared, it goes through sterilization processes. So this medium or culture or the nutrients must go through sterilization under high temperature. So if there is any microorganisms currently in that medium or the blood, it will be destroyed or killed, and then to be used to prepare the food or the nutrient for the growing of the microorganisms. So if I got your question right, it means that those nutrients or the blood agar that are used to prepare the nutrients do not contain any organisms that will interfere with the laboratory investigations that is being carried out.
Oh, okay. Okay.
Yeah.
Thank you so much. Great. Someone also asked of the disposal. Someone asked of the disposal. I don't know. I think the first person.
The question of the disposal, please come again.
No, sir. I said disposing the sharp object. Is it good to be buried or to be bent, or I don't know? Where do we have to dispose it of? Thank you.
You need to be disposed appropriately using the incinerator. The incinerator contains high temperature, and then it can burn these sharp objects or needles. So you need to use the incinerator, not ordinary digging the ground and then burying them. It could be exposed, but we use the incinerator to burn them, which contains high temperature.
Okay, thank you,
So
sir.
when your facility is not having the incinerator, you contact the facility who is having the incinerator so that you package all these sharp boxes and then send it to them so that they will do the proper disposing of for you. If your facility is not having an incinerator, you package it and then you send it to the appropriate quarters for it to be done.
Sir, please,
So
can I share an experience? Can I share an experience about disposing of the sharp objects? Okay, so I went in one clinic where they didn't have an incinerator, and they also didn't want to get this waste management to come and pick it up and take it to a bigger facility for them to burn them. So we normally mix it up with the normal bin containers, the one that Zumla will come for. I kept warning and warning and warning, and then one day we went for some screening and we had quite a number of HIV patients among the samples. Then our cleaner got struck by one of the sharp objects, and then the syringes. In fact, we had to check and check, took her through the process. Unfortunately for us, there was another lady who had already got struck with it, and she decided not to inform anyone. She thought, oh, Pandian Awami and that is it. The other one, we took her to the ART for them to give her some prophylaxis for her to take. And then after 3 months, we checked and she was okay. But the other, and this was a normal contracted infection from the hospital. She got infected because of that particular exercise. So it's one thing that I've always been cautious when I visit any facility that after container, it is compulsory in every facility, so that you make sure you dispose it of very, very well. So this is the thing I want to share. Thank you, sir.
Thank you too for sharing. Okay, let's go on then. Maybe after we'll take the questions again. So we are looking at disinfection, which is also very important. Purpose of disinfection: to eliminate or reduce pathogens on surfaces and equipment, to prevent infections and contaminations. This is the main purpose of disinfection, which is very important, because we have to know that we could pick infections ourselves. We could contaminate the samples we are sending. Either you contaminate the samples or you pick infections home. And the hospital settings or the health settings, we have the nosocomial infections. And then when we ignore these infections and then we pick them to the house, we could either go and infect our families, children, and other relatives that are close with us. So we need to practice this infection control procedures, and the standards need to be followed. So with disinfections, we have disinfectants that are commonly used. We have the alcohol-based disinfectants. That is the
So we can't see
70%.
you.
You can see.
I wanted to ask if you were sharing your slide, but you cannot see your slide.
Yes, I was
I
sharing
think you
it.
stopped sharing.
Yeah,
But you
sorry.
stopped.
Okay.
Oh, okay. Thank you, sir.
Okay. Let me. Okay. Can you see now?
Yes, we can see it.
Yes, sir.
Okay. So we are looking at disinfectants that are commonly used. We have the alcohol-based disinfectants. That's the 70% alcohol. And then we have the chlorine compounds, either the 5% bleach, what we normally call parazole. And then we have the hydrogen peroxide. These are common disinfectants that are mostly used. It is 70% alcohol because at 70% it is very effective. And then can inhibit the growth of most microorganisms. Then we have the chlorine compounds. That is the chlorine solutions, which is mostly prepared at 5%, which can also inhibit the growth of most microorganisms. And these disinfections are done on surfaces. When you are using the chlorine compounds on inanimate surfaces, then you use the alcohol base, the 70% alcohol base disinfectants on animates. That is maybe you use it to wipe the puncture sites. You can use it to disinfect your palms after samples are taken. But bear in mind that hand washing is very critical, which is one of the most important ways of preventing infections. If you don't have the alcohol-based sanitizers, you can do the regular hand washing, which is very important. Where to disinfect? So here we are taking samples, so we are not talking at the laboratory benches, but the place that you took the sample. When the client came in, either on the bed or you made the client comfortable before taking the sample. The bench or the table that you pack your items for taking the sample, where the client sat, the where you touch during the sample taking need to be disinfected with this 5% alcohol, a 5% chlorine solution. So you prepare the chlorine solution and then you use it for the disinfection. After cleaning the table, you leave it a while, wet as it is, for it to dry by itself. You don't use the chlorine solution to clean the table and then after you wipe it, you just leave it for it to dry by itself. So let's say 15 to 20 minutes it will dry and then the disinfection will be well done. High touch areas like the door knobs, the light switches, shared equipment and then handles. Maybe you have the tourniquet, you use it for a patient, you have to disinfect that tourniquet before it is used for another patient. Door knobs, the client came in, by all means the client will open the door. So those handles that the client touch, you also touch it. So you need to disinfect those handles. When to disinfect before and after use. Disinfect surfaces before sample is taken and after sample is taken. After spillage, clean and disinfect areas where spills of biological or chemical materials have occurred. Maybe a client, you collected a urine sample from a client. Unfortunately, it was not well closed or it was not well capped, and then you had a spillage. You need to disinfect the area that the spillage took place. During the taking of the blood sample, you had a spillage. You need to disinfect that area, the portion where the spillage took place, so that you prevent contamination and what? Infection. Then the last one for today is hematology. This one, we have it in the previous slide. So we just look at it and then we'll mention one or two hematological tests and then we'll look at it. I will send the assignment, which will be done in the form of presentation after the lectures, to the class rep, so that it will be distributed to the various groups. Hematology, which previously we talked about, scientific study of blood and its disorders, as well as the organs involved in blood formation. So let's look at the composition and physiology of blood. We have the red parts, and then we have the fluid parts. So the cellular parts, we have the red cells, and then we have the white cells, we have the platelets. Okay. Any questions so far?
Madam Donette, use the microphone. Use the microphone. Hello.
Madam Donette. Madam Donette. Madam Donette. Madam Donette.
I'm sorry, sir.
Charles, your hand is up.
Oh no, please, maybe the previous one. Sorry, sir.
Okay, David.
Yeah, thank you, sir. Please, my question has to do with the urine containers. After collecting a sample, can it be reused again?
Yes. Okay. Ideally, ideally
It's my
is
question.
no. Yes. Ideally is no. Because to reuse it, it has to go through so many processes. It needs to be well washed. They need to be sterilized. So going through these processes, which maybe you don't have the equipment, maybe the autoclave and then the dry air ovens to do the sterilization, it is advised to use a new one.
Okay. Okay. Thank
So
you, sir.
ideally,
Please,
it's best practice to use a news container for each specimen collection.
okay. Thank you very much. Please, my next question has to do with, some of our facility, we have a mini labs using let's say, that be syphilis. With those tests, is it advisable? Sometimes you read the this in the you read the instructions on it, and they will tell you that use whole blood, or you can skin the blood. What is the two? Which one is more advisable and can give us accurate results?
So with this one, it depends on you. When you pick a test kit, you need to read the instructions from the manufacturer and then understand the instructions and then the principle behind the instructions. So if it states that you can use the whole blood, or it states that only whole blood, then you go for only whole blood. If it states that you can use the plasma or the serum, or you can use the whole blood, then you go in for it. So it depends on the manufacturer's instructions.
Okay.
A typical example is you want to do pregnancy test and you have the test kit of a urine pregnancy test kit,
Yeah.
and then you go and take blood and then you dip the blood, the pregnancy test kit into blood, assuming there are hormones in the blood. But the manufacturer has stated that this test kit is for urine. So you don't use blood to do urine pregnancy test kit. So you don't use the urine pregnancy test kit for blood pregnancy or the serum pregnancy. Are we okay? So you always abide by the manufacturer's instructions. And before every test kit or cassette will come out, it has been tested. And then the specificity and the sensitivity have been tested before they come out.
Okay. Okay. So, sir, please, my last question. For those that can be, we can use serum. Can we still use buffer on them?
Yes. So per the instructions from the manufacturer, if it states that maybe 20 microliters of the serum and a drop of buffer, you follow those instructions.
Okay. Well
So
understood.
we don't assume that every test kit follows the same procedure. So each test kit that you take, you read the instructions and then you go with it.
Okay.
Okay, any other question? David, any other contribution?
Hello, sir. Hello.
Okay, go ahead, Willie.
Yes, sir. I mean, my question hasn't been answered still.
Your question again, please.
Yes, I was asking why do biomedical scientists and lab investigators, especially medical doctors, why do they take a cultured sample from separated wounds and sores? Why do they use that method of extraction? Because I think it's invasive, and the infection, the causative organism may spread to other delicate organs. So I wonder why they know that and they still go ahead and do it. I want to understand the reason behind it. Thank you.
There's background. There's noise at the background, so the question is not coming well. Someone's mic is on.
Mr. Mavoji,
Instantly.
Doc, thank you.
Okay, Willie, now you can go ahead. I think it's okay now.
Okay. Thank you very much, sir. I was asking why do laboratory investigators and biomedical scientists, especially sometimes even medical doctors, why do they prefer to a cultured extraction for separated wounds and sores in very, very weakling patients and very, very chronically challenged patients? Because the little bit I know is that if you touch such things, you touch source which are separated, and you extract things from it invasively, the causative organism may spread to other delicate organs. So why do they still go ahead and use a cultured extraction for sores and wounds which are separated? Thank you. Hello, sir. Can you hear me?
Yes, I can hear you. So, with your question, the sample needed and the appropriate site for the sample is very important. So, the site that the sample is being taken is very important because the microbes or the organisms are concentrated at that particular site. Do you get what I'm saying?
Yes,
So,
yes,
if
please. I do get it.
yeah, so that's the main reason why the sample is taken from that site. So you will get a good sample for the analysis because a good sample gives a good result. So the site of sample collection is very important for the analysis.
Okay, I get that, but is it okay to do it at the expense of the health of the individual? Because if you, I recount one experience I had at one of these government teaching hospitals in Kumasi. There was a friend of mine who's a medical doctor, and he had a patient who was separated seriously through cellulitis. So he picked a sample, like a blood cultured mechanism, used a sample and the causative organism came out all right, but they couldn't treat it. It spread rapidly all over the body, and within just a week, he was dead. So, is it ethically laudable to still go ahead and do such extractions at the expense of the life of a patient? I want to understand.
Before the sample is taken, I think there should be an assessment. There should be an assessment by the scientist or the medical doctor to know if the procedure which is being carried out will be helpful. If it's going to be very helpful, then there shouldn't be a problem with taking the sample, because you need the diagnosis for the treatment. And without the sample collection, you won't get the accurate diagnosis. So in both cases, it's helpful, it will be helpful to the client, and then it will be helpful to the doctor for the diagnosis. But when we are always looking at the pains that the client will go in, then our diagnosis wouldn't also be complete, because we have intentions of helping the client get better. So if that's the way that we can help the client get better, then we ignore a little bit of pain that the client will go through. And then if that's the only appropriate method or procedure available at that time, then it could be used. Are we okay?
Yes, sir, I'm okay. Thank you very much.
Emmanuel.
Yes, sir. I want to add a little. The reason why maybe you want to treat it from the side. Sometimes you can even get what is wrong with the person from the blood. But some people may have a condition where they have poor blood circulation. So maybe lab tests have been done several over and over again from the blood sample, and they are still not getting what organism is causing the damage, especially if the wound is not healing. So with that method, a sample has been taken from the open wound. And I don't know what the other person you're talking about did, but normally it's just something very small, just a small sample is taken, or a swab, a cotton swab, you used to take a pass from it, something small, so that you go into the lab and find out what organism actually normally culture, to find out what an organism is causing it, and also do the sensitivity test to know how you can treat it. So those are some of the reasons why. And what I have seen so far is normally safe. It's normally safe. So I don't know what my brother saw or how the other one took place, but generally it's very, very safe. Thank you, sir.
Welcome. Okay, we have Stephen. Stephen.
Yes, Doc. Good evening. Um,
Good evening.
my question is that the cans or the bottle, the tube, if you want to take a samples of the materials, I refer to blood or urinary or tissue, what quantity do you need into these tubes? My second question is that can you take these samples of these materials from any part of the body, especially the blood, from any part of the veins, or there are specific veins according to the organ you want to do or run the test for? Thank you.
Okay, so for blood tests, blood is in circulation. So since blood is in circulation, you will be able to get a quality blood from a visible veins from any part of the body. Is your question answered?
Yes, let me accept this way. As a blood circulation, you need to get the quality. But what I want to know is that we have many type of the veins in the body according to the organs in line. And then also, example, kidney, liver, and so forth. Um, all the veins, you can just tap all this blood from any vein at all. That is what I want to know because according to the organs in our system, as I mentioned earlier on.
So the best practice is to take a venous sample from a visible venous vein from either the back of the arm or the back of the hand or around the arm area.
That's what I want to know, sir. Thank you.
Are you okay? Stephen, okay. And we have Meshach. Meshach, Meshach, your hand is up. Blessing. Can you hear me?
Disposing. Yeah, please, can you hear me?
Okay, go ahead.
Hello? Yes, please. I
Yes,
want
go
you to
ahead.
recommend. Yeah, I want you to recommend to us the best way of disposing the waste materials, as separating them in various bins.
Okay. Blessing. So I'll take the last two questions and then. So let me take one from um, Christiana.
Yes, please. So I want to find out samples taken from the back of the elbow and then from the fingers, that's the capillaries. Are they the same? Can you use the same? Assuming you find it difficult getting it from the back of the elbow, there's the cubital vein, and then you decide to take it from the capillaries. Will the results be the same? Will it be accurate?
It depends on what kind of investigation you are going to undertake. Most of the time, capillary samples, and you won't get enough samples from the capillaries. But it's always advisable to take a venous sample from the veins, not the capillaries.
Thank you.
Okay, Blessing,
Yes, Doc.
your hand is up and it's been up for a while.
Hello.
Hello, sir. I think sir is off.
Yes, please. He's having a little internet.
Went off. Thank you. I can see Steven's hand up. Steven, your hand is up. Do you have any contribution to add?
Sorry, sir. Yeah.
Any contribution or addition? Okay, blessing. We ended the class in 5 minutes time. Blessing, you can go on. Blessing, your hand is up. Any question or contribution?
Hello. Hello. Hello,
Go
please,
ahead,
can you hear
Blessing.
me?
Hello.
Yeah,
We can hear you. Go
yeah.
ahead.
Okay. I was asking a question that you taught us how to separate the usable material, the waste material, put them in their various bin, and then I want you to tell us how can we finally dispose them or throw them away so that it will not pose danger to anybody.
So,
Thank you.
with this particular question, the facility has a procedure and a protocol they use to dispose of their waste. Some facility have a bigger site where they have the incinerator and other methods of disposing the waste. Others to contact the service of waste disposable companies. So after you have done the proper segregation, it's left with the facility and its protocols of disposing the waste. Either they will contact a waste management facility of a company, or they have a way of disposing their waste. But the most important thing is to do the proper waste segregation.
Thank you, though.
Ambrose.
Yes, sir. Good evening, everyone. Yes, sir. I think in regards to what my colleague just asked, some of us have our own facilities, and some of us too are working on building our own facilities. And it looks like the answer you gave is to uh, different companies. So, what about we that we have our own facility, or we are yet to have our facility? In case we should have our facility ready, maybe by the end of this month or next month, how do we go by disposing those materials? Thank you very much.
Sir, please can I answer Mr. Amos? This concern.
Go ahead, Comson.
Okay, now, so good evening, everyone. As regards to what Dr. Amos just asked, For me, for instance, let me take my lab for instance. That is dynamic medical diagnosis. So we don't have a disposal facility. So we have we work with the district hospital and the polyclinic around it. So they do our disposal for us. So we do appropriate separation, then we send it to them, then they dispose it for us. That's what I have been doing at my lab and my clinic. Thank you very much.
Thank you.
So it's not about just sending them to them because my lab is being regulated by HESLA. So we do appropriate records for them to know that we are doing proper disposal at my end. Thank you very much.
So to add up, if you want to do that, then you need to contact the appropriate agency or facility to help you uh, draw a plan or a structure on how you are going to go about it. For you having your own facility, it will be best for you to contact the appropriate agencies. So I will come in and then we'll take you through the proper methods and then the procedures available. Or either you a facility and then as Unsim said, you liaise with them and then you come into an agreement on how they will come in for your waste or how you are going to send your waste to them for proper disposal. But if you want to have your own method or procedure, then you need to contact the appropriate and then the well-regulated agency to help you go with that. Because if you don't do it well, they will come around and then they will find problems with you if you not take care. If you don't take care, they can lock your facility down. Because waste disposal is very important. Any other contribution? Okay. Kumsi, do you still want to add up?
No, sir. Thank you. No, sir.
Okay. I think Emmanuel Ba, Dr. Emmanuel Ba, your hand is up. I'll take this one and then.
Okay, sir. Okay, sir. I also want to add up. Let's say where you are, you don't even know who to contact. The best way is to go to any public facility, a public hospital. Go there, go and see them. They will have the administration block. Go there and then find out from them if they have an incinerator and then how well they can also come in for your waste product so that they can incinerate it for you and how much they will charge you. That will be one of the easiest ways. So approach any facility that is almost every big hospital facility have that particular setup. You can enter there, make inquiries, or they will now tell you, okay, for us to come and pick it, you contact maybe the car that will come for the hazardous waste company or whatever. They'll come and pick it up from your facility and bring it to our end. Or they will show you another method where you can transport it to their end for them to do that for you. So the easiest way is that you just ask, feel free, ask the nearest facility and they will help you out. Thank you.
Yeah, sir. I want to add something.
Go ahead, please.
Okay, so for some of we the HEBA the private facilities. Sometimes we are afraid of going to the public agencies for help, or it's because our place is not properly, the documentation of our place is not properly well. So sometimes if we are going to them, it seems like we are going to expose ourselves to them. That is why some of us don't do the right thing concerning the waste management aspect. So I am encouraging all of us that we should do proper documentation. Your place must be well registered so that when you are going to them, it's not seems like you are going to expose yourself to them. Thank you very much.
That's perfect. Thanks for your contribution. Kumsin,
So I'm here.
your hand was up.
Okay, sir. That's the old one. Thank you, sir. It was the old one, sir.
Okay, okay. So, in the absence of no further contribution or questions, then we can bring the class to an end. Ima, your hand is up.
Yes, sir. Good evening, sir. Sir,
Go on.
hello, dog.
Please go on.
Yep, sir, a friend of mine is having a technology that he can burn all those things. Is it advisable for you to take all those waste disposals to the place so that you can burn it?
Okay. Um, for now, I don't know what kind of technology the person is having, and if it is in line with the Environmental Protection Agency's regulation. So I can't really say much about it.
Okay, okay. Yes, I hope so. It's with the land with Environmental Protection Agency. That is where he normally burn all his waste. And he built it. It's a bio kind of technology that he developed. He learned it from China.
Okay, okay.
Okay, thank you, sir.
David, David will be the last person.
Okay, sir, please. With the disposing of the waste products from the lab, whereby someone is not close to, let's say, the environmentals and the process waste in, let's say, a manhole or a public toilet, can those things be deposited there?
Please come again.
I'm asking that whereby a facility is not close to, let's say, a big hospital or the EPA. So after that, those waste, can it be deposited into, let's say, a public toilet, heating, what we normally call the heating? Can it be deposited there?
No, please, it can't be.
Okay.
That's inappropriate.
Okay.
Okay. So, in the absence of no questions or any contribution, then we can bring the class to an end.
Please, the homework, the assignment, when is it coming?
Today or tomorrow, I'll send it to the class rep and then to be given to you.
Thank you, sir.
Okay. Have a wonderful evening.
Sure.
Same to
Thank you
you.
so
Wonderful.
much, Doc.
Bye, everyone.
Bye.